Hello, everybody, and welcome to Community Conversations. My name is Luke Margolis. I'm the Director of Corporate Communications here at Atlantic Health System, and today I am joined by Dr. Michael Girardi, an emergency medicine physician here at Atlantic Health. Dr. Girardi, thanks for coming in.
Oh, my pleasure. And I think the topic is very timely.
It certainly is. If you have been outside, as I certainly hope you have, because the weather today is gorgeous, then you certainly, and maybe felt a little scratching in the eyes or a runny nose. Perhaps that's allergies affecting you. And so today's topic, how to manage your allergies, is something that we hope will be of a good general interest to our whole Atlantic Health System audience. Dr. Girardi, I want to give the folks at home just a quick sense of how our community conversations work, and then we'll jump right in. Sound good?
Yeah.
All right.
Sure.
So, if you've never seen one of these before, basically this is going to be a conversation between Dr. Girardi and I, but it also includes you too. If you hear something you want a little more information about, or perhaps triggers a thought in your mind, feel free to enter those questions into our chat. We've got folks monitoring, and we're going to try to get to as many of those as we can. We also have a number of questions that were sent in ahead of time by folks, so we're going to do those too. We want to give everybody a fair shake. Thank you to everybody who submitted a question. But if in the event you got to bail out of our conversation today, or you miss a part of it, all of these are posted. First and foremost, subscribe to our YouTube channel. They're all posted there, but you can also find them on our website, atlantichealth.org, which also has a number of important resources that I know Dr. Girardi and I are going to talk about today. Again, that's atlantichealth.org. So that's how it works. Let's go.
Okay.
All right. We talk a lot about the seasonal nature of allergies, but allergies for some folks can be a year-long thing. I guess talk a little bit about what folks are experiencing this time of year, and what exactly goes into having seasonal allergies.
Okay, well, thank you. Today is the prototypical allergy day. Yeah. It's sunny, the trees are blossoming, and our cars are all yellow and green right now.
Mine was.
So that you don't have to go to pollen count websites on a day like today. You know it's as bad as
you run your finger along the hood and you can see it.
Yeah, I dust the pollen off coming in. It's just
yeah.
But it really starts in March, and it goes through the fall.
Okay.
With different types of allergy seasons. This time of year it's tree pollen. Okay. Then we're going to June, we're going to grasses. Okay. Then we're going to go into the fall, we're going to ragweed. And then in the winter, believe it or not, you have mold and mildew and animal dander and dust mites because you're captured inside.
If you're allergic to one, are you allergic to all?
No. All your allergies are different. You develop allergies as children, and usually after 20 years old, 30 years old, they're more quiescent. But if you were to move from a different place and have new stimulants, new allergens, you can develop allergies middle age or your mature years.
So, in fact, it's interesting you mentioned that. We had somebody who submitted a question to us who loves living in New Jersey. His name is Edward, actually, so thank you, Edward, for the question. Said, he never really had allergies, but this year they're really causing him some trouble. And he's wondering, perhaps it's the trees that are outside his home. The leaves haven't really sprung out on him yet, but he said, I don't want to move to the desert or to a city. He wants to stay where he is. But that might not cure it even if he did, right?
It wouldn't. Don't move. Let me tell you something. People go out west to Arizona to get away from asthma triggers or allergy triggers, and they have cedar out there and other trees that really cause a lot of problems.
So you could run right into something.
You run right into, right. In the city's not any better because you have dust mites and animal dander and closed spaces, and all this stuff blows west-east anyway.
Wow.
So you can't escape it. And we'll talk about that. And talking about moving away from it, actually the allergy pollen counts have gone up 20% in the last 30 years.
Really?
So our allergy season's worse than it was 30 years ago.
All the masking and stuff we did over the last couple of years, that I would imagine that might have helped a little bit and cut some of this stuff down.
Well, that's one of the treatments for bad seasonal allergies. Actually, wear a mask outside so you don't breathe in all that pollen. And you could also control it by the time of day you go out. The pollen times are worse in the morning, 5 to 10 a.m. and 4 to 7. The plants have learned that that's when the insects are out and birds, et cetera, that's how pollen works. They
transported from
fertilizes the other trees, et cetera. So that's over time we've learned that the middle of the day is the safest time to be out and decrease your exposure. What
are the symptoms of it? Like, how do you is it traditionally the itchy eyes and the runny nose, or are there other symptoms of allergies too?
Yeah, and sometimes they're confused with COVID. So let's talk about this.
Oh yeah, great point. Yep.
So children, they're rubbing their eyes a lot. They're rubbing their nose. They're chewing with their mouth open when they normally don't because they can't breathe through their stuffy nose when they're chewing, so that's a little sign. Allergic shiners, they have these little dark things under their eyes, or a red crease across your nose from constantly rubbing your nose. So those are signs for children. Adults, runny nose, burning in your eyes, teary eyes, cough. Like unexplained cough could be
seemingly comes out of nowhere.
Yeah, subclinical wheezing, or it could be irritation of your airway. And so people go, Right now with this COVID pandemic, they're coming in to get tested for COVID, but I actually talked to them. It turns out that they actually have allergies, seasonal allergies.
Which I would imagine is a huge relief for them, but the symptoms do seem to be somewhat similar.
Right, if you had a Venn diagram, they cross over. Wow. So you have fever and body aches, obviously you're going down a viral pathway. We're still in a viral season, flu season, COVID. But if you don't have body aches and fevers and whatnot, you could be dealing with this terrible pollen season.
Wow. All right, I mentioned we've got a couple of questions. I want to get to just a couple of those, and we'll kind of feed them in throughout our conversation as we touch on a number of things. But why don't we start first? You mentioned some of the symptoms. Mary Ann wants to know, can allergies affect your hearing?
Yes, because of the stimulation from the allergens, you have a lot more mucus production, and therefore when you have mucus production, it drains on the back of your throat, and it can go affect your eustachian tubes, which drain your middle ear, inner ear to your back of your throat, and that gets inflamed, and therefore your ears feel clogged, and therefore it decreases your hearing.
Wow.
So I see this symptom quite a bit, and we'll talk about the treatments in a couple minutes, but yes, good question.
So Susan wants to know, which she just expressed having some of the symptoms that we just talked about. Noses are running all the time. Mucus is clear, no temperature, sort of this waking up, and when you wake up and go to bed, these feelings like maybe they've smoked, all their lives, even though they never have. And the concern being, look, we hope this isn't COVID, right? So sounds like those could be allergies, so maybe Susan can rest a little easier knowing that might be what it is.
Right, and we talk about treatment. You can also do a diagnostic test on yourself. Start treating yourself and see if the symptoms get better. And we'll talk about
the types of treatments you can do. One more, and then I want to pivot to that. You mentioned predominantly kids will experience allergies. Can you all of a sudden start getting allergies as an adult?
Yes, you can, because if you're exposed to a new pollen or a new type of grass that you were never exposed to because you moved into the area, you could develop middle age or in your mature years acute allergies.
Okay. One last one on this, and then, well, actually, this is a perfect transition. Valerie has a question about treatments. The use of a neti pot, or some sort of like nasal sort of irrigator. Can those help for allergies?
Pure holistic, no medications, just humid air helps wash out your sinuses, and that is definitely recommended, especially for pregnant women who don't want to take many medications. Because decongestants like Sudafed, phenylpropanolamine can be teratogenic or maybe cause birth defects in the first trimester. So in the second and third trimester, it's okay. But let's talk mainstays of treatment.
Yeah.
Not 95 saline.
Yeah, we'll take a big picture step back.
Right.
Somebody thinks, oh man, I've got allergies. They come to see you. What would you recommend?
All right. Well, first of all, avoid the real high pollen count days. Go to the pollen websites and see what the pollen counts are those days. Go out in the middle of the day. 2, steroid nasal inhaler is a great way to suppress the allergies, stimulating your immune response. Okay. So steroid nasal inhaler twice a day during the peak, and then go to once a day.
And you can get those at like a drugstore or a pharmacy or something like that.
Costco, right. And we also write prescriptions for it. The next step would be oral antihistamines, Allegra, Claritin.
Those big brands.
And Zyrtec.
Over-the-counter medications.
These are mostly non-sedating, and you can take them in the morning, and you could be good all day.
Oh, well, that's the thing too. They work, right? I mean, if you're suffering with allergies, there may be a sense of, this is just my lot in life. This is what I've got to deal with.
No need to suffer. No, and then there's another layer of theory called monoleucast. There's histamine release from these mast cells, and monoleucast suppresses that release. So it's another layer of treatment. Okay. And some people have it really bad, can get allergy shots. Let's say you light up like a Christmas tree and you go to an allergist and you're allergic to every oak tree in our area and cedar, et cetera. Sure. You could get allergy shots. It takes 6 weeks, 6 months sometimes to kick in, but it really changes people's life because it suppresses the allergy symptoms.
So that's I think you made a good point there that might be worth tucking into a little bit as well. Places where you can go to receive care for something like this. I guess let's talk about your experience with patients in this area, and then additionally too, that allergists are folks that people can visit as well. I guess describe the range of opportunities for people.
Okay, just like a layered approach with medications, you could go to your private physician, your family physician, internist, pediatrician. The next step up, you have acute symptoms. You don't know whether you have COVID or sinusitis. We'll talk about that too. You can come to urgent care centers or the advanced urgent care center in Mountain Lakes, where we have CAT scans and x-rays. They can actually see if you have sinusitis that needs to be seen by an ENT, ear, nose, and throat specialist. Because if you have chronic allergies, you could develop chronic sinusitis, and you may need some procedures.
And let's do that. What's sinusitis?
Sinusitis is an infection of your sinuses. Children have developing sinuses, and the frontal sinus, for instance, this one doesn't develop till they're 8. But the point being is that sometimes people get occluded and infected, and therefore they'll need antibiotics, and sometimes they need surgical procedures to open up to increase the drainage.
So there could be a range of treatments that may be necessary.
Yeah, and we don't, because you have allergies and you've stuffed up and you have a headache and you have a pressure, doesn't mean you need antibiotics. That could all be allergies. It has conversation very frequently.
What if you aren't totally sure what you're allergic to, or you maybe have a family history of allergies and you're worried maybe that's in the cards for you? Is that when you go to see somebody like an allergist for a test or something like that?
Yes, you can, and that's when they could do testing for you. But you can also do the pollen counts on the web and see when your symptoms are worse. Like if you're really bad right now, May 5th, happy Cinco de Mayo, by the way.
Yeah, that's right.
You've probably oak or maple trees and all the trees, cherry trees, you name it, in our area. So you can do your own sleuth, be your own sleuth, and figure it out.
So, and I think that's a great opportunity for me to reference some of the materials we have available for you to use, or if you want to learn more about what's available here at Atlantic Health. I know that Dr. Girardi mentioned the Advanced ED Urgent Care. Go to our website, atlantichealth.org, and there's a couple of links at the top. One of them is Find a Doc, right? The Find a Doctor link, where you can find Dr. Girardi and others, and you can search by geography, you can search by specialty, you can search by name. All that you're looking for is available through that link. Now, you can also find our locations button there too, and that can help you find geographically all the different physical locations where you can go to receive care. And there's also virtual and telehealth opportunities through the website as well. Definitely a great resource if you are perhaps new to the area and don't have a relationship with some physicians, or curious to learn a little bit more about the types of resources we offer. AtlanticHealth.org.
Can I just mention
jump in, sure.
Flonase, I mentioned over-the-counter antihistamines, but also eye drops. Pataday, Visine A. Visine A means antihistamine. People get their allergies stimulated, triggered by the pollen in their eyes. So that's another way to suppress your allergies.
Excellent. Susan wants to know, can you take those types of medications if you're also taking antibiotics for something else?
Yes, you can. They're not related. They work totally differently. They don't interfere with each other.
Excellent. Good
so
to
you
know.
can take them even if you're taking antibiotics.
You mentioned this a little bit before, natural remedies. You talked about a neti pot. Are there other homeopathic or natural things that you've seen success with? That's from Erica, by the way.
Thank you for the question. Actually, I talked to a homeopath this morning about that, and she's Ayurvedic medicine, and she said, you want to take honey from the site where you live. It has to be made where you live, because that's what the pollen gets in there from the bees.
Okay.
So you want to get local honey, will help suppress allergies in some people. Other than that, vitamin D's not been shown to work, and I'm not a homeopath. I'm busy enough, but you can go to different websites and see what may work for you. I'm not poo-pooing it, I'm just saying that I could tell you that vitamin D has not been shown to work, but local honey has been shown to work.
Excellent. And that, I think that's also two nutritional implications. There was a question we got regarding different foods you can eat, things along those lines. Can the things you ingest, can those exacerbate your allergies or make them worse or anything along those lines?
Yes, I was thinking about that, because if you have food allergies, let's say you have peanut allergies, or just not, if your immune system's getting inflamed, it's like pouring kerosene on a fire. So people tend to have tougher times with their baseline allergies, non-environmental allergies, during pollen season, because everything it's all worked up and inflamed. And that's where I would go actually to oral steroids. If a person came in with that type of situation, I have allergies all year round, food allergies, and then they get into pollen season and they're miserable. They're breaking out in hives or they're itching all over. Then I'll add anti-itching medicine, or I'll add oral steroids for a short burst to just quiet things down.
Tone it down a little bit. We may have touched on it, but I want to just refocus. Allergies and pregnancy. What's good advice for pregnant women to know about allergies?
Well, two things. Number one, your allergy. If you have allergies, they get worse during pregnancy.
If you have them, they get worse. Okay.
And number two, there's something called pregnancy rhinitis, where just because of being pregnant, your nasal passages get inflamed.
Okay.
Or swollen. Not so much inflamed, it's swollen. That's where a neti potty would be good for a pregnant woman. But yes, pregnant women can develop worsening of their allergies during the pregnancy. And then you just talk to your doctor about what's safe. Like Flonase should be fine, and some antihistamines are fine. They've been studied. But really avoid the decongestants though in the first trimester.
So we've covered a lot of ground here, but I think that the big takeaway for me, at least as it relates to seasonal allergies, is that there is hope for dealing with them and for managing them. That you're not sort of stuck just dealing with the symptoms by yourself. One last one for you, and then I'll get some final thoughts from you, Dr. Girardi, before we go. Okay, so March to, I think you said it was October, or somewhere around there?
The first frost.
The first frost.
The first frost kind of a date where things kind of really quiet down. Then you're stuck with the inside allergies. Like
Well, that was going to be my question. Then are you in the clear, or is there other stuff to think about too?
Most people are, unless you have year-round allergies. Really, this is the worst time of year.
All right.
And then the grasses, but this is the worst time.
Any final thoughts for our audience about how to cope with living with their allergies?
Well, unfortunately, because of increased CO2 and the rising temperature, for whatever reason, I think we're going to worse and worse allergy season, more and more pollen, an extended allergy season.
Okay, so look, not the best of news for folks who struggle with it, but hopefully you heard some things today that provide you with some useful information to help you manage your allergies and your allergy symptoms. So, Dr. Girardi, thanks for coming in today.
Well, thank you for having me.
All right, folks, hope you enjoyed the conversation. And again, be sure to subscribe to our YouTube channel where you can find this community conversation and all of our other ones. For Dr. Girardi, I'm Luke Margolis. We'll see you next time.